Welcome to HealthWatch. This show is about exploring health topics that matter to you and your family. We appreciate the opportunity to introduce you to local physicians and health professionals who serve as our health experts. Our guests today include Dr. Philip Brown, Novant Health's Chief Community Impact Officer, Belinda Phillips, Lactation Consultant with Novant Health Brunswick Medical Center, and lastly, Dr. Lori Tackman of Novant Health Pediatrics Brunswick. So stay tuned to HealthWatch to learn more. Our first guest today is Dr. Philip Brown, Novant Health's Chief Community Impact Officer. It's so nice to have you with us today, Dr. Brown.
It is great to be here.
I'm excited to get to know you. I know that you're with New Hanover Regional Medical Center, and you're now part of us. So let's talk about a little bit about your background. Tell me where you went to school and how you became a doctor.
So working at New Hanover Regional was a trip back home for me. I'm a Wilmington native, graduated from New Hanover High School and UNC Wilmington in undergrad. And then I went to East Carolina for my medical school and my general surgery residency as well. Then I took a little detour up to Baltimore, Johns Hopkins University for my vascular surgery fellowship, and then spent 2 years on faculty at East Carolina as assistant professor of vascular surgery. But in 2004, I had a chance to come back to New Hanover Regional and come back home. And it was so nice to be able to come back home and take care of the folks that I grew up with.
Yeah, we have several, we've had several guests on the show who have grew up here and went away to school but came back to take care of their community. So that's really nice to hear.
It's really rewarding. You know, sometimes it's tough depending on the nature of what you're taking care of, but there's really nothing like practicing close to home.
Yeah. Well, I would really like to talk about your new role as Novant Health's Chief Community Impact Officer, and that's our very first one, I believe.
It is, and I'm so excited to have the opportunity to do this because it's so aligned with the mission of Novant Health. I mean, when you say that we exist to improve the health of communities, one person at a time, right? I mean, and so this is a chance to say, okay, well, let's make sure that that health of communities really is improving. And you know, part of my role will be to help define that, to get the metrics around it, to really understand, not just are we helping people one at a time, we know we're doing that, we're really good at it.
We are.
The remarkable patient experience in every dimension, every time is a real thing that we do well. But looking at how the health of communities improves is a little bit more complex. So that's one part of the job of several others.
Well, we at Novant Health like to say how we go outside our walls. We don't just practice within our walls. We go out into the community, into the homes, and where they are. You meet the patient where they are. So why do you think that's so important?
Well, I think we had a great example of it during COVID-19 when we tried to understand what it took to vaccinate patients, and when we looked at the patients that were getting vaccinations very early on, we were horrified because we realized it wasn't consistent with our shared driver of diversity, inclusion, and equity.
Right.
And so we had to reach out into the communities in new, different, and accelerated ways, and we did. And when we did that, we were able to really make vaccination equitable. And that was so rewarding, but it's really instructive of what the future is going to hold for us and how we need to be in the communities. And our health system is actually a member of each community that we serve, and understanding what it means to just be not only a service to the community, but a community member is really important. And it's really exciting to be a part of that kind of philosophy.
It is. I know you're part of Novant Health's diversity and inclusion team. Is that correct?
Yes.
And Let's talk about health equity. We hear that buzz, that's just the new thing to talk about. Everybody's talking about health equity. Explain to me what that really means.
Well, in its simplest terms, health equity just means that every person has the opportunity to reach their highest level of health. And that's really what we're all about in terms of taking care out into the communities, in terms of really that inclusive environment that we have, being able to understand better what our patients' perspectives are so that we can really deliver that remarkable care in every dimension, no matter where they attach to our system.
In your past, have you ever been so involved with health equity and diversity and inclusion as you are with this new role?
Well, for the last 5 years as chief physician at New Hanover Regional, we really began that journey in earnest, and it was a very important part of our strategic plan, and it was a great part of our focus. What I'm really excited about in terms of being a part of Novant Health is that Novant Health has been on the journey longer. There's more experience there. There's an incredible opportunity to learn, to accelerate. There's no reason to think that our part of the journey will have to be at the same pace because we have the benefit of the system expertise. That's exciting. So for me, this role actually allows me to attach to my sense of purpose in delivering health to all people just so closely. It's wonderful when your job and your sense of purpose are so well aligned.
Yeah, you're right. I think that I used to teach diversity and inclusion. When we first brought it to Brunswick Medical Center, I was one of the first instructors. And I can't tell you how much I learned. First of all, I thought I was very in tune to that, but I soon learned that I had a lot to learn too. But that's such a rewarding experience, and you have such great conversations with your employees, and then to act on those and to take it out into the community. But all of our employees here, all of our teammates, everybody goes through that same learning. And it's just been a great thing. And as you said, Novant Health is way ahead of the curve when it comes to health equity. And I noticed, I saw something on TV, and I believe it was New Hanover Regional Medical Center employees going into homes and giving vaccination. And that was the first I had seen that.
Absolutely, and I have to tell a story because
Absolutely.
Novant Health sponsored a 5K Sprint for Swimclusion race, which was a fundraiser, a fundraiser for a local swim nonprofit that brings free lessons into historically marginalized communities. And we as a system sponsored that event, and a vaccination event accompanied it. So we did that together, right? So we did a 5K race, but we also did a vaccination event for the community. And it just so turned out that we had 3 left over. And so I called a community member who's a close friend of mine, another high school contemporary, and she sent me to a place about 5 blocks up from the start-finish of the race. And when I walked in, I immediately recognized the patient because I'd known him since I was 7 years old when he was playing high school basketball for my father. And it was so rewarding to really make that connection. And he actually went back into a room and brought out a picture of that basketball team from the 70s and showed it to me, of himself and the rest of the team that played for my father. So it really is about getting into the community and those levels of trust, whether it's the one-on-one or whether it's the things that we did in churches and community centers where we really take that care to the patients. And the same thing with the Michael Jordan clinics. We're really listening to the communities about what they need to have, be a part of it, and what they feel like the health needs are. And we're going to do our level best to meet those in the communities we serve.
Speaking of those clinics, I'm so excited about that. It's going to open up doors to so many people for such needed care. The one in Charlotte is so, it's just so successful. People love it. So we're really excited to see that happen in Wilmington. There's a great need there. So this area is so large and it's very diverse. It's both rural and cosmopolitan. How do you see the growth here? How are we going to bridge that gap between rural and, say, Wilmington?
Well, it's going to be a great challenge, but we have wonderful partners. We have in existence, some magnificent parts of the system. We have practices in many different places. We also have the new relationship with the UNC School of Medicine.
I'm glad you brought that up.
And that is going to open up all kinds of doors for our community. And the other thing that I'm really excited about in terms of that is the expansion of training programs locally, as well as with Novant and Charlotte, there's some expansion of training there with that part of our health system. And so it's going to give us opportunity to have people who we train stay here and continue to serve our communities. And we really know that's how it works.
I love that.
It really is.
I think having UNC as a partner, it'll be a pipeline for us to get new physicians or physicians to stay in the area, because once they do their training, if they've had children here, they've put down some roots, it'd be nice to be able to offer them additional positions. And we're looking forward to what it will bring to Brunswick Medical Center, because we haven't had the benefits of having a residency program or very many medical students and what have you. So I think it's going to be hugely important for Brunswick.
It is, and the other thing that it also allows is going to be a focus on our health care provider workforce. One of the things that we really need to do, and it's a system effort all across the system, is to really get our workforce to very closely resemble the communities we serve.
Exactly.
And so another focus of my role is really helping develop some of those plans for healthcare workforce pipeline development, right? So how do we really, in our particular regions here at the coast, but really centrally as well, we know that we actually need more African American providers. We need more Hispanic providers for sure. As we get out into some of the more rural areas that we serve here, we need Native American providers. And those are things that we're really dedicated to pursue over the next decade. We intend to be a leader in that, just like Novant Health was the first recipient of the Health Equity Award nationally.
Right, they were.
And so, we can lead in the provider space as well, and that's really all healthcare careers, because we know team-based care is what it's all about. And the diverse and inclusive environment that we're creating sets up beautifully for team-based care at its very finest. So that's something I'm truly excited about.
Me too. I cannot thank you enough and tell you what a pleasure it's been to have you on the show today. I want to definitely have you back soon. I think you have so much more to say, and unfortunately we just don't have the time today, but you will come back, right?
Absolutely. I'll be here a lot. Thanks for having me.
You're quite welcome. Now let's welcome Belinda Phillips of Novant Health Brunswick Medical Center. Thanks for coming today, Belinda.
Thank you for having me.
I guess you are with Novant Health Brunswick Medical Center, but you're also with the Novant Health Medical Group, right?
I am. I've started in with the Novant Health OBGYN office and in lactation. I'm a board-certified lactation consultant, and I work in that office also to help educate mothers and families on breastfeeding and lactation, how to take care of their babies and feed them after they're born. So we give lots of education over there.
Some of our viewers may have met you at some of our events and have seen you around. I know you're involved with lots of different things, like the baby shower that we've had. And just all sorts of things. So they may have seen you, or they may have been a patient of yours. Who knows?
Yes.
Yeah. So tell me what your focus is: lactation support and education. So how does that occur? Does that start before the birth?
It does. So in my job, I think what we've really come to recognize in lactation is the more educated a mother family is about breastfeeding, how to feed their infants, the more successful they are. So we start out in the OB office and give lactation education there. We move into the hospital following them after birth and make sure things are going well for them in the hospital while they're at their hospital stay. And then we also offer postpartum education and follow the baby through their going home and give those resources. Recently, I've been asked to come into the pediatric office and give mothers the help they need in the pediatric office as they're coming in for their visits. So they come in with the baby for the first time, weighing in, and they can talk to lactation and get questions answered, make sure things are going well for them while they've left the hospital.
Once the infants go home, how long are you available for follow-up after?
Actually, I'm available for follow-up as much and as often or as little as they need me.
Really?
Yes. So I give them a phone number to contact me, and they're able to use that phone number to contact me 24 hours, 7 days a week. So we're really proud of here at Novant our follow-up, our resources that we're giving moms to follow up. They can come in for lactation consults. So even if they choose a different pediatric office other than Novant, we would like for them to be able to have access to lactation no matter where they're going. So we have phone conversations, we can do video visits, we can do actual in-person visits with families. And we are also offering now, fun fact, I don't know that you're aware, but we are actually able to do our baby cafe in person now.
Oh.
So Baby Cafe is our support group for our postpartum moms feeding babies. So after the whole COVID thing, we've been doing video visits, Baby Cafe. So just this week, we started doing our Baby Cafe in person. Actually, yesterday was my first one. So
Did they bring babies?
yes, they bring their baby. We do this, we offer this in our cafeteria classroom here at the hospital. So every Wednesday from 10 to 12, we're able to meet in person with moms. They bring their babies, they come. We are currently masking still, come in the front door and go through the COVID questions, and they'll just come in with their mask and their little baby, and we'll weigh babies, get to meet and greet, and see other moms that are there. So it's lots of fun. I'm very excited about resuming Baby Cafe.
So you had that prior to COVID.
Yes, and we had 10 to 15 moms coming
Really?
every week for Baby Cafe. It was a great service. They kind of banded together as a little group. They called each other and stuff, and they would meet once a week to come in for Baby Cafe and find out how everybody was doing that week. So it was a neat little group that they had going. So it was very sad when we did have to stop that. We did have some success with the video visits, video,
It's just not the same.
the Zoom Baby Cafe, but it's all of us across Novant that had baby cafes. We're so excited to be resuming them.
So it's not just here at Brunswick,
No,
it's all of our
it's
facilities.
a Novant corporate support group for our families.
And how long can they come to that?
Especially their whole first year when we're encouraging breastfeeding. So generally babies are breastfed for a year or longer, just however long they choose. So my goal is to help a family meet their breastfeeding goals. So yeah.
What advantages do you see for both mom and baby for breastfeeding? What are the advantages?
So with the moms, they just keep adding to my list. So with breastfeeding moms, the longer they breastfeed, they reduce their risk of breast cancer, ovarian cancer, thyroid cancer, heart disease, high blood pressure, type 2 diabetes, and postpartum depression. So that's just some of the things that we've...
depression too?
Yes, absolutely. The oxytocin kind of helps with the mental health also as the baby's breastfeeding.
I also hear they lose baby weight faster.
They do. That's generally one of the things my mothers are the most excited about.
Yes, they're going to lose weight.
Yes, absolutely. And then with the babies, we see the research is telling us with the longer babies breastfeed, they're reducing their risk of the ear infections, respiratory issues, asthma, gastrointestinal issues, SIDS, which is a very scary thing.
That is.
There are lots of cancers, and so there's just a lot of benefits health-wise for both mom and baby. So it's kind of been really interesting as I've gone through this career, kind of learning more about breastfeeding and all the exciting new things they find out.
So it seems like the mom is really involved, and there's so much. It's too bad the dad's.
That is the thing that I get a lot of times with breastfeeding, that dads want to hold the bottle to kind of bond and things like that. So we talk about dads get to bond with babies, especially with skin-to-skin contact. So
Really?
holding, yes, absolutely. Right after they're born, we want those dads participating in the skin-to-skin contact,
I know
holding that
moms
baby.
do that, but I didn't know about
yes.
dads.
Yes, that's one of the things, and they're like, oh, I get to do that too. And so it's very exciting for them too.
Oh,
so
that's
do
cute.
that skin-to-skin. And it's more exciting to sit there and hold your baby and than just playing with the bottle with the baby. So I think that's
Yeah.
been a very positive thing, encouraging them to take that time and bond with that
Well,
baby.
and then sometimes, do they still drink water from a bottle?
Not so much. Actually, what's recommended is that all they need is just breast milk for the first 6 months. That's the current recommendations. Is all the baby needs is breast milk for the first 6 months. Then we start adding in solids at 6 months, and that will. You want to just breastfeed first because that's your main source of nutrition for 1 year. So lots of
Yeah.
breastfeeding
That's
for the first
great.
year. Yeah.
Well, geez, I learned so much today from you, Belinda.
I'm constantly learning too.
I would love to have pictures of your baby cafe.
We'll work on that. We may have had some from last year. I think they might have took a few from COVID, but as we
Awesome.
keep increasing, we'll work on that.
Awesome. Well, come back and see us really
Thank
soon.
you. I
always
appreciate
bring
that.
us such joyful information. So
Thank
it
you.
was great to have you.
Thank you. I enjoy coming.
Thank you. Our final guest today is Dr. Lori Tackman of Novant Health Pediatrics, Brunswick. Welcome to the show, Lori.
Thank you. Thanks for having me.
It's great to have you back. We've had you on before, and this is usually the time of year that we have you on because we're getting ready to send our kids back to school.
That's right.
So we're happy to have you here. But before we start, talk a little bit about your practice, Novant Health Pediatrics, Brunswick.
Yeah, so we are a general pediatric practice. We see newborns through 21, 22.
Wow.
Do the whole thing.
The whole thing. So they're not
Babies on up.
Well, today I want to talk about children going back to school, and it's been an unusual year with
Yes.
the pandemic. We've been stuck in the house for a year and a half, and it's impacted everyone, including
Yes.
our children.
Definitely.
So they're going to start socializing again and being in person. So what advice do you have for students to help them re-enter that?
Right. Definitely seeing this a lot in the patients that
Are
have
they
been coming
nervous?
in. They are. I actually saw a couple children the past few days where the little ones haven't been to school.
Oh,
Ever.
yeah, I never thought about that.
Yeah, and so they're really anxious, and so I advise the parents to have them go to the school at, a safe time, and just kind of get familiar with the layout of the school. If there's a way that they can meet with a teacher beforehand, that would be awesome. If they know some other children that are going there, maybe in our class, that they can maybe get together with one or two of them so they can kind of have a special friend they already know when they go to school. Another thing too for the older kids is that they need to start getting on a more regular schedule because these kids have been staying up till late at night and sleeping in. So try to ease into a more regular schedule with waking up early and going to bed earlier, and just working on their good sleep hygiene so they're getting to bed at a reasonable hour so they're fresh and ready to go.
It could be scary for kids. When you said that, that kind of struck me. They've never been there before. They don't even know what the school. So it's like, wow, that's going to be something for them. And then even just returning. When you've been away from something for so long, if you're
Yes.
off for 6 weeks or whatever, and you go
Right.
back to work, you feel like the strange person in the office.
Right, exactly.
I can't imagine what kids feel like.
Yes, but I think it's going to be wonderful because children do learn a lot better in person, hands-on, right there with visual, hearing, touching. So they need the whole and socialization. They need the whole thing.
What about hygiene in schools? What are you recommending to your parents? Are the kids going to mask, washing of hands?
Well, just check with the school, what their
Oh, yeah.
policy is going to be. But definitely they need to be washing their hands frequently, not getting too close to people if they seem like they have the sniffles or coughing. And, well, the first thing is if they're not feeling good, they need to stay home.
Stay home.
They need to stay home, but lots of good hand washing and, masking if the school requires it.
We'll be going into flu season again too, so the regular flu, so that the masking, I think, helped with the flu this past
Absolutely.
year.
Barely saw any flu at all. So that was great. Yeah, it was the one good thing.
So let's talk a little bit about vaccines. We'll just start with COVID. What is the CDC recommending right now for children?
So things are
vaccines.
changing all the time.
Yeah,
So just
seems like daily.
Yeah. So just go to trusted websites, American Academy of Pediatrics, CDC. Just stop by every once in a while, see their new policy changes. But right now, the CDC is recommending 12 years old and up, they can get the 2 doses of the Pfizer vaccine.
I think it's only Pfizer, right?
Yes.
Yeah.
Yep. Yep.
So let's talk about regular vaccines. Now, I know there are several they need before they go to school. So tell me about those.
So before kindergarten, of course, they need the MMR, varicella, and Tdap, the tetanus, diphtheria, pertussis, and polio, the last one of that. Then when they're teenagers, or 11, 12, they need to get the MMR follow-up and the meningococcal vaccine and their Tdap again. And then when they're 16 to 18 years old, they need to get that other meningococcal vaccine. So they need, and everybody needs a flu vaccine in the fall.
Well, Dr. Tackman, I know that some of us adults, we have experienced some depression or just some anguish over not being able to connect with one another. Have you seen that it's affected children in any particular ways?
Definitely. A lot of children are a little more withdrawn, having some anger issues, seem a little more sad, and because they're away from their friends. They're not out there doing activities. They're a lot more fearful. So it's really important when they're going back to school, parents keep the line of communication open, keep on asking them how their day is, how things are going. If they seem kind of down or acting kind of hopeless or kind of angry or having anger outbursts, parents need to talk with them and just see what else is going on. It's probably not them just being stinkers, but that something else is bothering them. So definitely keep an eye on that. Let your pediatrician know if they are seeing a lot of mood changes or sadness, anger, because kids really do need socialization. It has affected them, and their whole world has been changed. So.
Yeah, and we've been so careful about telling people to wash their hands and wear that mask and don't do this and don't do that.
Right.
They probably are so confused, they don't know what to do. And now we're going to throw them back into school and they're going to be exposed to all these people and different things, and they probably are frightened.
Right, and just, reiterate with the children and older kids too, just keep on washing your hands, wear the mask when appropriate. If you forget to do it, don't feel guilty. It's okay.
That's the thing,
because I've also had that too, that children are like, oh my
yeah.
goodness, I forgot to wear my mask, or I didn't wash my hands. And so it's okay. Let them know it's all right. Wash them now. It's okay. But yeah, just keep an eye on their mental health and keep them active and go outside and
enjoy the sunshine.
Right, enjoy the sunshine. Have them be around their friends again, and we're going to be great.
Well, good. Well, I appreciate you coming on today. It's always
Thanks
good
for
to
having
see
me.
you, and we always like to know what's going on with schools and kids and what have you. So I hope you'll come back again really
I sure will.
soon.
Yeah, thanks for having me.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. To find a doctor or learn more about services at Novant Health, visit novanthealth.org. Be sure to join us next time for Health Watch on ATMC TV.
KMC TV, your community channel.